I would just have no stamina, no strength, no endurance.
I felt awful. I thought, well, maybe I'm going to have a heart attack.
I never thought about atrial fibrillation. I never thought it would be a problem.
It would just show up one day, and as strange as it was that it showed up, the next day it would go away.
I was surprised, mostly because of my age, and I didn't have any chest pain.
I guess disbelief was probably the biggest emotion I felt.
The formal diagnosis was chronic or persistent atrial fibrillation.
The whole experience of having the episode was much more frightening than simply knowing I had the condition.
Education relieves anxiety. Knowledge is power, and the more you know, the more you will be able to articulate appropriate questions. I think the best advice is to learn as much as you can. Take every opportunity to ask questions to your physician or your nurse practitioners. Go to programs or classes that are offered in your community about atrial fibrillation and stroke prevention. Because atrial fibrillation is so common in the general population, once you're knowledgeable about atrial fibrillation, teach somebody else.
Heart rhythm irregularities actually are relatively common. There are numbers of types of irregular heartbeats, extending from single extra beats to a significant number of beats strung together in a row.
Atrial fibrillation is by far the commonest heart rhythm abnormality that we see. Fortunately, in most cases, it's quite manageable and not dangerous, and so despite its frequency, it is not generally a life-threatening problem.
About 2.6 million Americans are affected with atrial fibrillation. The number does appear to be growing. We are living longer, and as the heart ages, there's structural changes that happen in the heart that actually precipitate atrial fibrillation.
Atrial fibrillation can occur in just about anybody. It's more common in the elderly, and in fact, it's estimated that in people that are over 70, upwards of 10 or 15% of people have atrial fibrillation. But we also see it surprisingly in some very young patients. We have patients in their 20s or 30s or even their teens occasionally that will present with atrial fibrillation. To understand atrial fibrillation, you really need to understand kind of the basics of how the heart works. The heart pumps blood, and it has 4 chambers. There are 2 upper chambers called the atrium, and those are the receiving chambers. The right atrium receives blood back from the body after it gets used up, and the left atrium receives blood back from the lungs after it gets replenished with oxygen. Those 2 chambers fill with blood, and they squeeze and they fill up the 2 lower main pumping chambers called the ventricles. The right ventricle pumps the blood out to the lungs to get oxygen. The left ventricle is the main pumping chamber that pumps the blood out through the aorta to the rest of your body. The heart's a muscle, and just like any muscle in your body, it's an electrical impulse that tells the muscle cells to squeeze.
The normal heart has a rhythm that we call normal sinus rhythm, which is a very regular movement of electricity, first through the upper chambers of the heart, then through a connection into the lower chambers. So the normal rhythm is a very organized, regular rhythm in which the upper and lower chambers work in sequence in a very regular fashion.
When the top part of the heart is quivering, which is what happens with atrial fibrillation or AFib, it does not optimally fill the bottom of the heart. Sometimes it beats very irregularly, sometimes it beats slowly, more commonly it beats fast and irregular. As a result of that, the function of the heart is impaired. It does not work normally.
Atrial fibrillation in many ways is a nuisance arrhythmia in the sense that the main problem that it causes are symptoms and the impact on quality of life.
When atrial fibrillation occurs, it is oftentimes like driving a car that is a 6-cylinder car when 2 of the cylinders are not working. Can that car go? Absolutely. Will it go optimally? Will it go in the best manner? Will it be the best use of that car? Does it potentially cause problems? Yes.
The atria, when they are quivering, they will lose their ability to pump blood efficiently. So blood will become stagnant in some part of the atria, and whenever you have stagnant blood in any part of the body, we'll have a tendency to form a clot. And this is exactly what happened in atrial fibrillation. So you have the atria, they are not beating, they are just quivering, and in some part of the atria, blood will not move, it forms a clot. This clot can go to the brain and cause a stroke.
It's important for people to understand that not every increase in heart rate is an arrhythmia, and certainly not every increase in heart rate is atrial fibrillation. Most of the time when our hearts accelerate, they're doing it for a good reason, and it's normal.
When someone has atrial fibrillation, there is significant variation in the heart rate. When you're sleeping or resting, your heart rate may be in the 40s. When you're exercising, depending on your age and your physical condition, you may get your heart rate up into the 170s. But typically in day-to-day activity, your heart rate will be somewhere between 65 and 90 beats per minute. But typically, most patients with atrial fibrillation are up at that high end. So they will bounce without any medication between 120, 150, 170 beats per minute, sometimes even faster. Atrial flutter is a very common rhythm disturbance, very similar to atrial fibrillation. Those of us in the medical field often call them cousins of each other.
And it's a very similar arrhythmia, but it is highly organized compared to atrial fibrillation, and typically the heart rates are fast but regular, unlike atrial fibrillation where the heart rates are irregular. Atrial flutter is associated with all the same kinds of symptoms and risks of atrial fibrillation. So patients may experience palpitations, shortness of breath, dizziness, weakness, fatigue. They carry the same stroke risk in atrial flutter as they have during atrial fibrillation.
Now, atrial flutter can be, believe it or not, harder to treat sometimes than atrial fibrillation because it's so organized. Fortunately, the treatment for atrial flutter is very straightforward. Medications tend not to work very well for it, but there's a procedure called catheter ablation that works very well, and of the procedures we do, it's one of the simplest, safest, and most effective ablation procedures. So the goal is... Atrial fibrillation is much more common than atrial flutter. We probably see it in only a fraction of the folks that we see with these atrial arrhythmias.
The patient's primary care providers are often on the front line of managing atrial fibrillation because typically when the patients have symptoms, they might be very vague, such as they feel fatigued or they have some level of activity intolerance, that they may call their primary care physician and say, hey, look, I haven't felt well, I'm not sure what's going on. If a patient is found to have atrial fibrillation, the primary care provider will typically refer that patient to a cardiologist for a further evaluation. Further diagnostic testing like a cardiac echocardiogram, perhaps a stress test, doing some blood tests to look at the thyroid. All of those things need to be initiated when someone is first identified with atrial fibrillation. Typically, once the patient is seen by a cardiologist, if further management is needed, then they would refer to a cardiac electrophysiologist, who is a cardiologist who has extended education in the area of heart rhythm management.